Hello everyone, I am Dr. Oritro Mondol. I'm a psychiatrist by profession, and I would like to talk about 30th March because from the perspective of psychiatry, this is a very important day. It is celebrated every year as World Bipolar Day. This is a date which also marks the birthday of the great painter Vincent van Gogh, who was a tormented genius during his lifetime and was posthumously believed to have had a bipolar disorder. Now, the initiative for this particular day was taken by International Bipolar Foundation in collaboration with Asian Network of Bipolar Disorder and International Society of Bipolar Disorders. The aim is to reduce stigma and increase awareness regarding the illness. So on this occasion, I would like to say a few words about bipolar disorder or bipolar affective disorder. Now, there is a lot of things that needs to be said about bipolar disorder, but in this short video, I would like to address some very common and very basic misconceptions regarding bipolar disorder, which is mostly prevalent in Indian setting. Now, first of all, what is bipolar disorder or bipolar affective disorder? Bipolar affective disorder is a mental health condition characterized by disturbances in mood, energy level, and activity levels primarily. In one hand, there is excessive increase in energy or elevated mood as occurs in manic episodes, as well as there is deep debilitating episodes of depression. So bipolar disorder is not just average everyday mood swings. This is an illness which is characterized by the said episodes which are distinct and which are sustained, sometimes for weeks, sometimes over months. So it is a debilitating disease. Now, as I have already said, it is primarily consisting of two extremes. One is mania and one is depression, even though there are many variations of bipolar disorder, but in this video I don't want to go into that. So when we say the term mania, oftentimes it is seen that when a patient comes to OPD and attendants say that this patient, sir, this patient has mania. Sir, इसको mania है. ये पूरा दिन हाथ धोता रहता है, ये पूरा दिन घर साफ करता रहता है, चीजों को ऑर्गेनाइज करता रहता है. So commonly when people are uttering the term mania, what they are referring to is some sort of obsessive or compulsive behavior. And it is true that in psychiatry as well, there is a particular category of disorders which are known as impulse control disorders. So if you see the names of those disorders, they do have the word mania contained in them, like pyromania, which is an irresistible urge to set things on fire, or let's say kleptomania, which is an irresistible urge to steal insignificant things. But when we look at the term mania separately, mania itself is a different clinical entity altogether, which is characterized by excessive energy, elevated mood, racing thoughts, impaired judgments, excessive talkativeness, a pathologically inflated sense of self, decreased need for sleep, etc. So it is altogether a different clinical entity, very different from what people generally understands by the term mania, and it does need timely medical intervention. Another aspect of mania is that since one of the symptoms of mania is over religiosity, people who are not otherwise very religious or spiritual, when they're having manic episodes, they become overtly religious all the time. They're chanting the names of gods and they're involved in religious activities, and oftentimes you'll find them saying भगवान मेरे अंदर ही है, दुर्गा काली मेरे अंदर है, gods and goddesses are inhabiting in my body. So the problem is that the family members do not consider it as an illness at that times. What they rather think is that that person, in Indian settings, that is, they understand that this person is being possessed by a Holy Spirit or a deity. So they do not think that treatment is important in such cases. And even if the family members think that treatment is important, oftentimes the first point of contact are faith healers. So by the time these patients reach hospital or reach the clinic of a psychiatrist, crucial time is lost. And in cases of acute mania, time is very important because without timely intervention, the behaviors of such patients can not only pose danger for themselves but also for the people around them. So that does need immediate intervention. Now, on the other end of the spectrum, there is depression. You might have heard a lot of people saying that I am feeling depressed today. And even though that might mean a transient state of mood, but clinical depression is altogether a different entity. It is a complex disorder with a very specific set of symptoms, including, again, disturbances in mood, energy level, initiative, um, inability to experience pleasure, altered patterns of sleep and appetite, and sometimes suicidal ideations. So it is not just a feeling that is lasting for a day or two. It is very um, pervasive and it is very sustained. And it will definitely disturb the activities of daily living to a greater extent. Now, while I am talking about this, there is another very interesting things which we can note nowadays, that people often say that um, this person is a little bipolar. मेरा boss थोड़ा bipolar है. When they say such a thing, it is not only clinically inaccurate, but it also minimizes the sufferings of those who are actually afflicted by this disorder. When they're saying such a phrase that this person is a little bipolar, what they actually mean is this person is having a lot of mood swings or there is problem in emotional dysregulation. But that can mostly be that person's personality trait, some disturbances in the personality, or that can also very well be a normal human variation, which is way different than a clinical diagnosis like bipolar affective disorder. Okay, so another thing that I can remember of is oftentimes what we have seen when a patient is suffering from bipolar affective disorder for a long time, that is, they have had multiple episodes of mania and or depression, they generally do have insight into their illness. That is, when they're entering the phase of mania, they do understand that this is the beginning of mania. But when they are in the manic phase, they refuse to take treatment because they enjoy that state of euphoria. So again, the treatment is delayed, which is problematic because the untreated episodes of mania can lead to more frequent and severe episodes of illness, thus potentially deepening the illness cycle. So these were few misconceptions that I can remember about bipolar affective disorder. Now coming to this year's theme of World Bipolar Day, which is bipolar strong, which means that there is hope with effective understanding, adequate treatment, adequate timely treatment, and a supportive community. People with bipolar disorder can live a meaningful and a productive life. So, thank you for listening, and let's continue to spread awareness and build a society which is compassionate for mental health.